In South Africa, over 7 million people are living with HIV, more than half of them on government-funded anti-retroviral treatment.
Well, the South African National AIDS Council has organised various activities for World AIDS Day, a day that's been commemorated since 1988 to raise awareness around the pandemic. But for more on this, we're joined by Dr Thembisile Xulu, the CEO of the SA National AIDS Council. Doc, good to have you. Good morning to you. And thank you so much for your time. I mean, every year we do this, right? We are in conversation on the 1st of December around issues of World AIDS Day. But what do you think is important to specifically highlight this year in 2020 regarding HIV and AIDS?
Morning, Tumelo, and morning to your viewers. Thanks for having us here. I think what's important to highlight this year is the impact of COVID-19 on the HIV and TB response. It's been hampered negatively. We have lost a lot of patients in terms of care. So people haven't been coming to facilities to test. They haven't been coming to treat. And not just for HIV, but also for TB. So we are focusing on bringing people back into care. So we want to encourage all South Africans to come back to care, to get their medication so that they're able to take their treatment, suppress the viral load, minimize the chances of transmitting transmitting HIV to others so that they're able to live long and healthy lives.
Doctor, do you think facilities failed in doing their job and making sure that everybody who needs the treatment gets it? I mean, what was the problem there? I know that obviously people were very worried about going out, but could more have been done?
Yeah, I think more could have been done in the sense that getting medication out to people at a larger scale. You see, this COVID-19 thing, Jay, was new for many of us. So when it started, it happened quite quickly. There was a lot of confusion. Even when we said healthcare services are essential services, people still couldn't go to the facilities. And when they did go, they were scared of the police. Sometimes they were scared of being incarcerated because there were areas where people were being incarcerated if they tested COVID-19. You know, so there were multiple factors which ended up with a situation where patients were not collecting medication. And from our facilities side, we do have mechanisms, for instance, for people to pick up multi-month dispensing medicine at a local pharmacy, at the retail pharmacies. Those projects could have been scaled up much better so that people continue to take their medication without necessarily having to come to facilities, especially if they are stable.
Yeah. And Dr. Xulu, I mean, to what extent has stigma also impacted the lack of collection of medication or even testing during this time? We know of a story of a particular, woman or individual who was stoned to death in a community in Durban because people had known her status or they had tried to out her. So there still seems to be that fear of stigmatization in our communities.
Definitely. The stigma is still there and we are still dealing with it. As I speak, we have a stigma index study going on and it's looking, at all types of stigma, the stigma that somebody has against themselves, stigma because you're a woman and because you've got HIV. And there's no doubt, for me, in order to address stigma, we do need all stakeholders to be applied and to be involved because it's got structural and social reasons where putting down a policy to say anti-stigma will not be enough. So there are those dialogues, those uncomfortable conversations that we have to have. But more than anything, I still insist that we need to put people on treatment because if the stigma, for instance, comes from the fact that somebody says, oh, Dr. Thembi's got HIV, and she's therefore spreading HIV. Once I'm on treatment and my viral load is suppressed, the chances of me transmitting HIV to the next person are almost nil. That then also helps to reduce the stigma because I look at myself differently and somebody else looks at me differently.
Yeah. But Doctor, a little earlier on you touched on how sad you are that you lost some people because they weren't able to take their treatment. But there was concern as we entered into the hard lockdown of COVID-19 that we would lose a lot of people with HIV and TB. That didn't really happen. Why not? What was it in their systems? What was it about the medication, those who were taking it, that protected them?
I think from a scientific point of view, I probably can't give you something from a peer-reviewed article that I can share, but I can certainly say we have been saying that as soon as people who are HIV infected start taking treatment, especially if they start taking treatment before their CD4 counts are extremely low, we are able to get immune reconstitution and get their immunity to essentially function like that of somebody who's HIV negative, and their lifespan becomes as long, and they can live to see their grandchildren. So we are seeing what insurance houses are describing, that HIV is a chronic manageable disease. So the fact that they were on treatment, that they were suppressed, that they were making healthy choices, actually contributed to what we are seeing, because it then just looked at them like the normal population.
And just briefly, Dr. Xulu, I mean, I know that the United Nations had, appealed to the whole entire world and global governments to ensure that, we achieve healthier societies. And their theme is under, global solidarity, shared responsibility. What activities have you planned as SANAC for today?
All right, so today we have a small physical gathering in Dobsonville at Itumeleng Health Center. This is where the Deputy President will be giving the country's World AIDS Day address, basically talking about the state of the nation. Because of COVID-19, there is the ability to link on many virtual platforms, including the SANAC Facebook website, as well as the other development partner sites. We are gathering under the theme, we are in this together, Cheka Impilo. And in parallel with that, so whilst, and so then what's going to happen at the venue is that the Deputy President is going to have a dialogue with girls and with young women or young people living with HIV, addressing things like some of the concerns and the interests and some of the challenges that they had, particularly during the lockdown. But more interestingly, they've got solutions to some of these challenges.
Right.
And then there's multiple activities happening in all 9 provinces, called Policy and Action, where we have been mobilizing, focused on women, on human rights, focused on children, and just making sure that we bring everybody to make sure that we catch up and that we are back in care in order to make up for some of the gains that we have lost because of COVID.
Okay, Dr. Xulu, very much for talking to us, and thank you for the work that you do.